Hi everyone, welcome back. So this is part 2 of the Gluteal series, and in this one we will be talking about the Gluteus Medius. We'll be talking about Gluteus Medius syndrome, otherwise known as runner's butt, and we'll also be talking about Gluteus Medius tears. So the gluteus medius lies between the gluteus maximus and the gluteus minimus on the side of the hip, and it contracts isometrically to help support the hip during weight bearing. Okay, so in this picture you can see the basic anatomy. So just below the iliac crest there at the top, you can see in green, spanning across the bum cheek, is the gluteus maximus, and just below that on the side of the hip in brown you can see the gluteus medius, underneath which of course is the gluteus minimus. Then at the front in red you've got the tensor fasciae latae, and of course you've got the IT band running off that along the side of the thigh. And of course in blue you've got the quads there. Now when the foot comes into contact with the ground during walking or running, and all of our weight is placed on that one leg, the gluteus medius will contract. And if we think about someone who is a runner, the gluteus medius will probably contract around 1,000 to 2,000 times every mile. Now this means that in a 26-mile marathon, the muscle would contract 26 to 52,000 times through the course of that marathon. So that's a hell of a lot. Also, the impact of landing on full body weight when running will equal about 3 times your body weight. So it's not surprising that the gluteus medius can suffer with overuse injuries, muscle spasms, when it's absorbing such a huge impact. When this causes pain, it's usually referred to as runner's butt syndrome. Now, of course, it can occur in people that aren't runners, but it's certainly common in runners. Gluteus medius syndrome can be misdiagnosed as sciatica, ischial bursitis, or sometimes hamstring strains or tendinitis. So, as we've said, it tends to be caused through overuse injury, i.e. it's common in long distance runners. It really affects only one side due to the natural asymmetry in our bodies, and it can certainly be sort of more likely in someone if they have, say, one foot arch is flatter than the other, then that will make that side more prone to this type of injury. Or, if there's some other sort of biomechanical abnormalities, such as, some people naturally have one leg that is, longer than the other, and it may not even be something that is immediately sort of visible to someone else, or one hip higher than the other. Just these little things that just cause a slight discrepancy, within the muscles and in our posture. Also collapsed arches in the feet, knock knees or knee valgus, which I've also got a video on, spinal scoliosis, which I will be doing a video on, or if you are a runner and you're running at a slight angle. And this is why, you'll know this if you've seen my IT band video. You know, I'll always say to runners, you know, don't always run on the same side of the road. You know, try to vary your route, vary the textures that you're running on, you know, because even on a road that seems to be level, there's always a slight tilt, to allow drainage, you know, of water when it rains, for example. So you're always, if you take the same route, you're always going to be running at a slight angle. Whereas, you know, if you sort of run on different sides, you'll sort of be evening out the strain on each side of, you know, your body. So these muscle imbalances and asymmetric loading of the joints will result in a one-sided injury, as we just said. So addressing the cause of that asymmetry as a preventive measure is really important, probably as important as the diagnosis itself. In terms of biomechanical abnormalities, obviously, you know, you can use things. If it's a case of a problem with the arches in the foot, you can use orthotics in your running shoes, you know, just to ensure that sort of everything is well aligned. So in terms of symptoms of Gluteus Medius syndrome, it usually involves a pain that radiates deep into the glutes, possibly into the thigh, increased pain while running, particularly if you're running uphill or you're suddenly running faster. The piriformis muscle may be affected and cause pain when sitting. There are sort of multiple symptoms, but not everyone will have all of these symptoms. So again, that can make it kind of quite difficult sometimes to diagnose. And diagnosis really of Gluteus Medius syndrome is usually down to eliminating other conditions such as sciatica, piriformis syndrome, ischial bursitis, hamstring tendinopathy, and through you know, manual palpation of trigger points. So it's kind of an exclusion thing rather than sort of specific tests that are going to say, yes, this is what it is. In terms of treatments, there is an issue that if you go to your GP and you say to your GP, well, it hurts when I run, the GP will probably tell you to stop running. They may prescribe anti-inflammatories, they may refer you for a back or hip x-ray, which will most likely come back clear, and then they'll probably refer you to physio, who, unless a physio has a diagnosis, will probably simply advise stretching and strengthening, you know, tight or weakened glutes. So that may not always be enough. So direct sports therapy to the injured area, and this could include things like ultrasound, electrical stimulation, kinesiology taping, joint manipulation, myofascial release, trigger point therapy, sometimes foam rolling, you know, or sort of specialised stretching alongside these things. As we've said, if there's any kind of poor foot mechanics causing the issue, getting some kind of orthotics would really help, just support the arches in the foot and sort of keep, you know, the natural alignment as it should be, and may also help sort of with shock absorbing as well. So that is your Gluteus Medius syndrome. what about a gluteus medius tear or strain? So the lower third of the gluteus medius is covered by the gluteus maximus, and together they form the buttocks. The gluteus medius rotates the thigh outwards, which allows you to walk in a steady manner without falling. The gluteus medius is attached to the femur or the thigh bone, near the hip or the greater trochanter, and the ilium of the pelvis. The greater trochanter has a bursa or a fluid sac, which will protect from any injury, and any inflammation of this, what's known as the trochanteric bursa, can also cause hip pain. So that's something to just be aware of again. Now, in terms of risk factors, certain medical conditions may actually increase the risk of a gluteus medius tear. So we're looking again things like that trochanteric bursitis that we've just mentioned, sacroiliac joint dysfunction, which is a common one, hip dislocation, piriformis syndrome, tensor fasciae latae syndrome, intervertebral stenosis, ankylosing spondylitis, cauda equina syndrome. All of these things can, sort of come alongside gluteus medius tears. So if you have any of those, you may, want to do some of the preventive measures to try and sort of get in there early and avoid these strains from happening. So causes of gluteus medius strains. So if you're sitting cross-legged for a long period of time, or if you are standing on hard floors for prolonged periods of time, this is going to put extra stress on that gluteus medius. Also, repetitively carrying heavy items and walking. So, for example, if you're like a manual labourer, you're going to be prone to a strain in this area. But also for mums, they're known for carrying, a child on one hip. And they often tend to stick to one side, and this can cause problems as well. Aggressive aerobic exercise, running, aggressive weightlifting, athletes in long jumps or high jumps due to the high impact of landing. Any of these things, and particularly if there is bad technique, are going to certainly increase the risk of a gluteus medius tear. And when you get one of these tears, you're going to experience pain in the lower back, sometimes in the hips and buttocks. The pain may radiate down the legs from the outer part of the leg to the inner part. You may well get pain when you're lying on one side, and you're probably going to have difficulty in sitting full stop for a sort of long period of time. You may also get pain with standing or have difficulty in walking. Possibly you may start limping to sort of compensate for that pain. So treatment, again, a lot of the sort of standard treatments for sports injuries: rest, anti-inflammatories, both warm and ice packs, for use sort of preferably immediately after injury. But of course, when it's an overuse injury, it's a gradual build-up. So, but certainly the cold packs to reduce inflammation, warm packs to relieve pain. You can also get some hip, buttock, thigh or groin supports, which may also help. but again, you know, with a lot of these groin supports, you do have to be careful, you know, not to wear them like 24 hours a day, because actually then some of the muscles can weaken. So it's more important to wear those sort of when you're doing some sort of activity that triggers the pain. So that of course is pretty much it on the gluteus medius. Obviously with regards to massage, you know, it's a lot of it is about sort of easing pain levels, following inflammation, you know, just helping with the healing process in general, helping to sort of regulate the nervous system, which may be triggering pain, and you know, sort of also helping to relieve any sort of stress or anxiety associated with those pain levels, and just generally sort of strengthening and helping to stabilize, you know, the area. So that's part 2 of this gluteal series done. In part 3 we're going to be looking at the gluteus minimus, and but any comments, do feel free to leave them down below. Subscribe to my channel and you'll see the other related videos that are already up to do with sciatica, and obviously the first part of this series, and also the IT band. But if you subscribe, you'll be notified when the other videos in this gluteal series come out. You can contact me through Facebook or Instagram. I'm on there as the Medical Massage Lady, and I will come back to you if you have any questions. Yeah, for now, that is all from me. So I will see you in part 3. Take care.